Working in Indraprastha Apollo Hospital as a senior registrar in pediatric cardiology. I also have my clinic on the side. I usually see patients. So yeah, that is about me. And today we are going to talk about newborn jaundice. I would like to spread some awareness about it so that you as parents can understand what it means in brief. So jaundice, it is very common among newborns. About 60% of term babies, they develop jaundice. And so I would like to start if there are any questions uh, about jaundice, I could answer them. So first of all, so the first question is, how can I tell if my baby has jaundice? So basically jaundice means yellowish discoloration of the skin and the eyes. So in your newborn baby, if you start noticing that, they are turning a bit yellow in color, you can try to look at other part of their skin, try to look in their eyes, because usually the white of the eyes, they turn into yellow color. Yeah, so that's how you can tell if the baby has jaundice. What tests are available to find out if the baby has jaundice? So jaundice is actually a symptom which is caused by high level of bilirubin in the blood of the babies. So if your doctor suspects jaundice, they're going to order serum bilirubin, total, direct and indirect. That's how they can they can assess the level of jaundice. How will I know if my baby needs treatment? So that is, there are many factors deciding if the baby needs intervention for jaundice or not. It is usually because jaundice is caused by various different reasons. So if usually it will be the doctor, depending on the general condition, they will decide. So all you have to do is go to the doctor if you suspect the baby has jaundice. They will be the one to decide. Will my baby's jaundice clear up on its own? That again depends on what caused the jaundice. Like there's something called physiological jaundice, which is usually, it is normal for babies to develop jaundice up to 14 days of life. If it is physiological jaundice and if the levels are within a normal range or bit slightly high, there are high chances that it will clear on its own with time. Okay, what sort of support can I get with breastfeeding? So physiological jaundice, which is almost a normal condition for babies, you can improve that by increasing breastfeeding. So basically feeding them every 2 to 3 hours or as per their demand. And if you're feeding formula milk, about 30 to 40 ml every 2 to 3 hours, that improves jaundice, yes. Other questions? What care does pregnant mother need to take to avoid getting jaundice in newborn? So basically, one of the reasons that babies can develop jaundice is incompatibility with mother's blood group and theirs. So make sure you determine what is your blood group, and if the baby develops jaundice, and they have to see if the blood groups match or they are incompatible. That is one thing. And the other is after birth, make sure you're breastfeeding the baby regularly, and that's it, no other care. How to identify jaundice in newborn? So as I said, look at the color of the skin and their eyes. The white of the eyes can turn yellow. One trick that I use is, because we have dark color, brown skin, right? So one tip is I use is I press the skin a bit hard, and if it's jaundice, the yellow color would be apparent on the skin for a while and then release. Yeah, so that is one way to identify jaundice. Any other questions? Why have you decided my baby should have this particular type of treatment? So there are treatments depending on what caused the jaundice. Like for example, if there's infection, the doctor will give IV antibiotics. Usually when the bilirubin level reaches up to a point that the baby needs treatment, there's something called phototherapy that we give. So it's like a blue-green light. We expose the baby's skin under the light, and then that light is absorbed by the skin, and it breaks the bilirubin molecules, and then the bilirubin is excreted in the urine of the baby. So that is usually one type of treatment that we give. Is it compulsory to keep the baby away from mother when the jaundice is detected in newborn? There's no compulsion like that. In fact, you have to be near them and breastfeed them regularly. Only when we are giving phototherapy, so that is the time we separate. So the mother is on the side, but the baby has to be exposed in the light. So we give a cycle of like 6 hours or 12 hours of phototherapy, but you have to take the baby and breastfeed them in between. Of course, you have to breastfeed the baby. There's no contraindication of breastfeeding when the baby has jaundice, unless there is a condition called galactosemia. You will know if your doctor says so, but those are very rare. Any other question about jaundice? Any tips that I can avoid to do if my baby has jaundice? You have to avoid dehydration. So make sure you're breastfeeding properly and make sure. So how do you ensure if the baby is hydrated? They have to pee regularly. So that's how you can check if the baby is hydrated well enough. One thing that we Indians also suggest, and there have been studies, you expose them to morning sunlight, like around 7 a.m. Go, like you have to be under the, you can go to the roof, the terrace, and get them exposed to sunlight. That has shown improvement in physiological jaundice. I can treat the baby at home, right? Do I need to visit the doctor? It depends. I would recommend to go if you think the baby is turning yellow and if you think it's increasing every day, you have to visit the doctor. Even if it is a physiological jaundice, it is better to get the consult of the doctor. Do I need to worry? My baby is 6 days old. He's suffering with jaundice. Most probably it's physiological jaundice, which should clear in 14 days of life. But I would still recommend so that the doctor can decide. They have a clinical judgment. They can decide what is causing the jaundice. Should I need to show sun to my newborn? Yes, early morning light, not too late, not like 9 a.m. or 10 a.m., but 6, 7 a.m. That has shown improvement. That exposure of that light has shown improvement. So if it is physiological jaundice, as I said before, there are many causes of jaundice. You know, your baby might be suffering from it because of some infection or some blood group incompatibility. Then the sun won't work, right? Then you have to get the jaundice tested. Any more questions? How many days it will take to recover? So it depends how, if, for example, if the bilirubin was high and you have taken the baby to the doctor and they have decided to give phototherapy. So usually phototherapy starts clearing out the bilirubin in 12 to 24 hours. So yeah, that is how long it takes. Can I massage my baby? Again, that is another dadi ma ka khazana technique that we use, and it has I have read studies that it has shown improvement where you massage the baby with a little oil in the morning sun, and it has shown to improve jaundice, but not high levels. Okay, physiological jaundice, low level of jaundice where the bilirubin is very low, that can be improved with time. Yes, make sure you're breastfeeding the baby regularly. So mommies, there's no need to be too worried if you see that your baby is getting jaundice. My main agenda here was that you be aware of something called physiological jaundice. I would just like to put that note here that it starts after 24 hours of life. It can go up to 14 days of life of the baby, and it is completely normal. As I told before, 60% of babies have it. So no need to worry as much. Just make sure that you're going for the regular checkup with your doctor and they can tell you if there is anything to worry about. So that would be my message. Any other question? Okay, great. So it was nice. Yeah, thank you. Thank you, Nayana. We have covered many things. It's such a huge topic that I really can't cover everything in this little time, but I hope that some of your doubts are cleared, and I hope that you see me again. Please follow me on Baby Chakra and use my referral code Dr. Afreen to buy products and get some discount. Right. So thank you so much. Thank you.